Okay, let's continue with our vasodilators and drugs for angina pectoris. Last time we have learned, class, that when you say angina pectoris, we are talking about chest pain. And what is the reason for this chest pain? We have lacking or lack of blood supply in the heart. Thus, there will be also a deficiency in oxygen. So we have different types of angina. The classic one is associated with too much exercise or yung exertion. There will be a lot of energy. Merong ginagawa na more than the ordinary activity yung person. So makaka-experience siya ng chest pain. Therefore, this one can be relieved by resting, okay? Aside from the nitroglycerins or our vasodilators, okay? Now, the one that is not really precipitated by effort is called unstable angina. So this one is an emergency case. Most of the time, this requires hospitalization. Next, the prinzmetal angina is when there is a localized spasm in a portion in the blood vessels. But this is still due to the atherosclerotic plaque deposited in the wall of the blood vessels. And lastly, the coronary artery syndrome, wherein the plaque plus gets ruptured, and because of the rupture or the injury, there will be the action of the platelets, and then there will be clotting, and therefore the blood flow will be obstructed. Magkakaroon ng blockade doon, and then talagang mawawala na ng blood supply in the heart muscles mismo. So this may lead to heart attack, or that's what we call myocardial infarction. Okay, so learning angina pectoris is like learning economics, wherein there is demand and supply. So our heart class has a demand for oxygen, therefore it has to be supplied. If there is a problem with the balance between the demand and the supply, then there will be a problem in the heart function. So I think we have started with our drugs for angina. We have the organic nitrates, wherein the nitroglycerin is the prototype drug. However, our problem with nitroglycerin is that this cannot really be given with oral administration, since there is an extensive first pass effect. So we have the other two, isosorbide mononitrate and the dinitrate, which can be given orally. Okay, so how about the mechanism of action? We have the release here of the nitric oxide, which results to the relaxation of the smooth muscle of the blood vessels. If the blood vessels class relaxes or relax, therefore there will be vasodilation. And if there is vasodilation class, it can help in the increase in the blood supply in the heart muscles. Okay. So where did we end? I think we ended here with nicorandil. So let's move on with the other group of drugs that we can use for our angina pectoris. So we have here the calcium channel blocker. Ay, tama ba? Feeling ko lagi na tapos ko na ito. Ay, natapos ko na ata, no? So aside from the nitrates, we have the CCBs. From the name itself, they will block the calcium channel so that there will be no calcium influx. Kasi calcium class means there will be contraction of the muscle. If the blood vessel contracts, there will be constriction. And that will reduce the blood flow. Hindi siya makaka-help in the angina pectoris. So we have two types of CCBs, right? The non-dihydropyridines, which are not really that selective, so they may inhibit both channels in the heart and in the blood vessels, but the dihydropyridines are selective to the blood vessels only. Okay, however, they are just used as prophylaxis for angina. We don't use them during the attack. So unlike the other forms of the organic nitrates na meron doon sa kanila na pwedeng gamitin during the attack. Now we can give this aside from angina, na discuss din natin ito for hypertension and our arrhythmias. And then we have the following, which can be used for hemorrhagic stroke and may reduce cerebral damage after thromboembolic stroke, aside from being a drug for angina. And then I'm guessing here, please remind me, because that's what I can remember. I ended here with the beta blockers pala. Okay, so aside from hypertension and heart failure, also our beta blockers are also used for angina. But take note, since these are beta blockers, they are drugs which inhibit the beta receptors, and that will result to the decrease in the function of the heart, decrease in the heart rate, decrease in the blood pressure, and even decrease in the contractility actions. So this is more on lowering the demand of oxygen of the heart muscle, since it will not really work na bonggang-bongga, no, hindi grabe yung work niya kasi pinapahina natin yung kanyang contraction, yung kanyang rate. So, ang demand niya sa oxygen bababa. That's how beta blockers help a person with angina pectoris. Okay? Hindi siya pareho ng mga vasodilators natin, na it's more on the supply. Because of the dilation, supply of oxygen in the heart will be increased. This time, it will be lowering of the demand. Para hindi masyadong malaki yung demand, no, ng heart natin, kasi nga hindi din siya masyadong masusupply because of the obstruction. So pahihinain na lang natin. Now we have here our newer anti-anginal drugs, starting with the trimetazidine. And I believe you are very familiar with this drug, the trimetazidine. Brand names, well-known brand names in the market are Angimax MR and yung Vastarel MR. Ito yun, trimetazidine yun siya. That's the generic name. Diba kung sa community kayo, mahirap putulin si Vastarel, kaya nakazigzag-zigzag ang iyahang tablet, no, sa iyahang butanganan sa blister package. But please take note, if you encounter this drug again, pag makadispense kayo again ng trimetazidine, please take note that this is a drug for angina. And this is maintenance drug because for prophylaxis. Now this one has a different mechanism of action. If you are asked what's the mechanism of action of trimetazidine, please answer this drug is a PFOX inhibitor. Okay, PFOX inhibitor siya. What do you mean by PFOX? PFOX means partial fatty acid oxidation. That's PFOX, partial fatty acid oxidation. Now, this drug will inhibit, remember, the fatty acid oxidation in the heart. Now, during myocardial ischemia kasi, if the patient class has a problem with the blood supply in the heart muscle during ischemia, na-mention na natin yan, what is ischemia? Kulang ng oxygen supply in the heart. Remember, our heart is a muscle, and for it to contract, it needs oxygen, and at the same time, it needs energy. So, our heart during ischemic conditions, yung kanyang energy comes mostly from the fatty acid oxidation. Okay? Kung sa body kasi natin, 'di ba, our number one source of energy for all our cells to function are the carbohydrates. But for the heart, during ischemic conditions, kumukuha siya ng energy sa fats. I-oxidize yung mga fatty acids, and that will give the oxygen. Now, ang fats kasi class, mahina kasi yan siya na source of energy. Mahina siya. Even in our body, pag fats yung kinukunan natin ng energy class, madali tayong mapagod compared to carbohydrates. So, ang mangyayari dyan, since sa fats kumukuha ng energy ang heart, mahina din naman yung beating ng heart. So, ang gagawin natin through the drug trimetazidine, we will inhibit the fatty acid oxidation para mag-shift class yung energy na supply in the heart sa carbohydrates. So doon tayo sa glucose oxidation. This is the reason why we are inhibiting the fatty acid oxidation for the heart muscles to get the energy sa glucose kasi mas malakas siya class na source of energy. So pag merong maraming energy kasi ang heart, it will function efficiently. Okay? Makaka-function siya when it comes to pumping, hindi siya mahihirapan. And during the pumping, it has all the energy to pump and supply blood, even if there are obstructions. Okay? So again, trimetazidine is just used as a prevention, a prophylaxis drug for our angina. That is also true for ranolazine. This is also a preventive drug for the angina attack. However, aside from the fatty acid oxidation modification, this drug has the same mechanism of action also with that of the class 1 antiarrhythmic drugs. This may inhibit late sodium current in the heart. So it will affect the pumping also. Syempre, 'di ba, the heartbeat is associated with our ions. So may synchronization dyan sa pagbeat ng heart natin. Now, if we are going to inhibit late sodium current in the heart, we are going to slow down the activity of the heart para hindi din siya magkaroon ng malaking demand on oxygen. Okay, that's the reason why if we are inhibiting the late sodium current. But at the same time, we are modifying, if we are going to use ranolazine, we are modifying also the fatty acid oxidation kasi para magkakaroon siya ng more energy to work. Okay, iba yung pinapahina natin yung kanyang activity sa bibigyan natin siya ng maraming energy, okay? I mean, what's the nalibog na? I'm distracted with the environment and surrounding ko. But anyway, again, ini-inhibit natin yung late sodium current to slow down the activity. Okay? Slow down lang yung activity pero pinapalakas natin yung energy ng heart mismo, okay? Para makaka-function pa rin siya. So, ang lagay niyan, ang effect niyan, ma-reduce yung cardiac oxygen demand. Kasi nga, mag-slow down yung activity ng heart if we inhibit the sodium. Okay? Mai-inhibit yung action potential. But it will improve the efficiency of cardiac utilization because it will have more energy kasi nga shifted yung kanyang source sa glucose, hindi sa fatty acid. Okay, so that is also true for us class. If we are going to eat a lot of carbohydrates, surely we will have more source of energy. If we're going to work a lot, hindi yung kakain tayo ng maraming carbs tas wala tayong ginagawa, ma-deposit yung lahat sa body natin. Pero kung gusto natin, marami tayong gagawin, carbohydrates talaga yung kukunan natin ng energy kasi mahina. Though fats, lipids class can still provide us energy, medyo weak sila na source of energy. That is also true for the heart. Okay? So clinical application, again, these two drugs, trimetazidine and ranolazine, are prophylaxis for angina. Okay? They will just decrease the demand in the oxygen, but it will give more energy to the heart for proper functioning. Okay. However, since, take note, this is for ranolazine, since it will inhibit sodium current, maaapektuhan yung synchronization ng beating of the heart, then expected talaga na in the toxicity, you will see arrhythmia. QT interval prolongation is like one type of arrhythmia, aside from nausea, constipation, and dizziness. But Besides, among the two, syempre trimetazidine yung mostly ginagamit in the market. I hope you have observed that one na pinaka-ginagamit sa kanila si trimetazidine. Okay? Actually, I have not encountered ranolazine ever since. Pero I have encountered ivabradine. If I'm not mistaken, ang well-known na brand name nito sa market is Coralan. Let us check if tama ako. Kung Coralan ba talaga. Are you familiar with Coralan? Yeah, tama. Coralan. So if you are going to have your duty on Thursday, you check these drugs, trimetazidine and then the ivabradine. The brand name is Coralan. So this one, itong dalawa, they are drugs for angina. So ano naman yung sa ivabradine? This is more on the sinoatrial node. It will inhibit the sodium channel, the hyperpolarization activated sodium channel in the sinoatrial node. If we are going to inhibit that, the sodium channel, so syempre yung action potential maapektuhan. Remember, it's connected in the beating of the heart. It will slow down. Mag-slow down yung action potential. And that means the heart class will have a slowed heart rate. And it will actually lower the demand in the oxygen. Kasi the more the heart works, kung mabilis yung heart rate mo, meaning yan yung mga muscles niya nag-work, no? All of the time. And nangangailangan yan siya ng maraming oxygen. Ang problema natin, hindi nga natin masyadong masupply yung oxygen kasi may obstruction in the form of atherosclerotic plaque. So if we cannot increase the supply, then ang ginagawa natin using these drugs is ibababa natin yung demand. So paano natin ibababa yung demand ng oxygen sa heart? Papahinain natin yung kanyang activity. Iso-slow down natin. That's what we are doing with ivabradine. We are going to inhibit the action potential so that the heart rate will be slowed down and hindi na siya masyadong mataas yung demand for oxygen. Okay? Do you have questions about our drugs for angina? Hindi masyadong marami yung drugs for angina, ha. Remember, we started only with the organic nitrates, but organic nitrates class are more on the increase in the supply kasi ipapadilate yung blood vessels, and since dilated yung blood vessels, there will be increase in the blood flow, so increased yung supply. Okay, that is also true for calcium channel blockers, most likely, since the effect of blocking the calcium channel is to relax the blood vessels. Also, there will still be vasodilation. Supply pa rin yun. Increase the supply of blood and the oxygen in the heart muscles to prevent angina or to treat angina. But the remaining drugs like the beta blockers, yung mga newer anti-anginal drugs natin like trimetazidine, the ranolazine, and the ivabradine, all of them are drugs used to reduce the demand. Okay, i-reduce din natin ang demand para makasugakod class ang supply. Okay, supply sa oxygen sa heart. That is still to prevent angina pectoris. So when you're going to study them, please study how they either increase the supply or decrease the demand. So I'm talking about the mechanism of action. Okay? Any questions before tayo mag-move on? Konting slides na lang ito. These are drugs for peripheral artery disease. Okay, peripheral artery disease, ha. Kasi yung nauna nating i-discuss, those are coronary artery. When you say coronary artery, we are talking about the blood vessels in the heart mismo. Kasi nandoon yung obstruction, kaya kulang yung supply. sa heart muscles ng blood. This time, we will be talking about the peripheral artery disease. Peripheral means other parts of the body. Okay? So when I say other parts of the body class, the obstruction, again, it can be an atherosclerotic plaque gihapon, but ang atherosclerotic plaque is deposited not in the coronary arteries, but the other arteries sa body. Okay? So ginagamit itong drugs na i-discuss natin most of the time for intermittent claudication. Okay? When you say intermittent claudication, there is an obstruction in the blood flow because of the plaque, the atheroma or the atherosclerotic plaque in either the large or the medium arteries, especially sa paa. Okay, nandoon yung plaque, doon siya na deposit sa paa. That's intermittent claudication. So, ano mangyayari sa person with intermittent claudication? May obstruction sa blood flow sa paa. So, ano yung mafe-feel nila? The pain class will also be sa legs. Okay? They will feel pain as in masyadong masakit kasi kulang ng oxygen sa muscles sa paa because of the obstruction in the blood flow. I hope you understood that one. What intermittent claudication is. Sa paa mismo yung obstruction, so the blood flow is slowed also in that part. So the pain is there. Masakit masyadong paa nila. Actually, yung lalakad sila class, magwo-walk sila, konting distance pa lang yung nalakad nila, hindi na nila kaya sa sobrang sakit ng paa nila kasi kulang na kulang yung blood supply. Yes, iba si cramps. Si cramps is something to do with the muscular contraction. Okay? Pag nag-cramp kasi yung iyong muscle sa paa, meaning niyan, nag-contract siya. Yung contraction is masyadong mabilis na there is no time for the muscle to relax. So if you're going to hold your legs, kung nag-cramp yan siya, di ba matigas? So yung muscle yan siya na nag-contract ng masyadong mabilis na no time for relaxation. So masakit din yan. Okay, masakit din yan. This time, sa intermittent claudication, walang muscular contraction. Masakit lang talaga yung paa natin, yung muscles natin kasi there is obstruction in the blood flow. Wala ding oxygen supply or kulang ang blood supply in that area or in that part. Okay? So again, that is called intermittent claudication. Now, what are the drugs that we can use for intermittent claudication? We have here pentoxifylline. The brand name is Trental. Please look at the pharmacy where you are going to have your duty or nagjo-duty kayo ngayon these days if meron silang pentoxifylline. Now, si pentoxifylline ay a xanthine derivative. I just don't know if you have encountered this in your pharmacognosy. Itong xanthine class are alkaloids. Xanthine alkaloids ito. Now, ano yung mga xanthine alkaloids natin? You have the caffeine, the theophylline, and the theobromine. Okay. So remember, di ba, si caffeine is mostly found sa coffee. So we have like Coffea arabica and Coffea robusta. That's the scientific name. When we study pharmacognosy, we include that one. Now, si theophylline naman is the alkaloid coming from our tea. That's Camellia sinensis. And si theobromine naman is the xanthine alkaloid coming from our Theobroma cacao. So, ano ba yung common sa kanila? The xanthine structure, and all of them can stimulate our CNS, though theophylline can be used for asthma also. But ito, pentoxifylline class, parang kapatid lang nila ito. This is a derivative of the xanthine alkaloids. However, ano na siya, derivative na siya. So, ano na ito, synthesized in the laboratory. Yung tatlo na nilist ko in the screen, these are natural alkaloids coming from the plants I have mentioned. So itong pentoxifylline has the ability to reduce the viscosity of the blood. So i-reduce yung paglapot ng blood para hindi mahirapan sa pag-flow. Kasi nga 'di ba may obstruction because of the atheroma. That's how pentoxifylline help a person with intermittent claudication. Let's reduce the viscosity para ma-improve ang blood flow. Actually, this is not only true for pentoxifylline. Even the other three alkaloids, caffeine, theophylline, and theobromine, are able to reduce the viscosity of the blood. So like when you drink coffee, class, coffee actually has this advantage or has this benefit, reducing the viscosity of our blood. My problem with drinking coffee is that most of us drink coffee na marami masyadong sugar, yung 3-in-1. Aside from the sugar, meron pang mga creamer, 'di ba? So it will not help. If you're going to drink coffee and get this benefit, you have to drink coffee as it is. Katong pait. Katong ano, may kanang pure lang siya na coffee. Kana, if you want to have this benefit, hana, ano, kanang maka-reduce ng viscosity sa blood to help us improve our blood flow. Okay? Especially for persons with intermittent claudication. Oo, kanang mga brew lang na coffee, class na wala kaayoy sugar, walay creamer, yan yung magre-reduce ng viscosity of the blood. Family sila ni pentoxifylline. And aside from that, this is the last slide kasi murag nagsugod na gyud ang meeting ni Dean, murag na bungganan ako siya. We have here the silostazol, the brand name is Plataal. If I can remember it correctly, the blister package nito is color pink. Now this one is a phosphodiesterase type 3 inhibitor. Na-mention na natin itong PDE3, 'di ba, last time. So PDE3 is an enzyme that will convert CAMP. Sorry sa kung agi wala ko dalang pen karon. Okay, so we have CAMP to AMP. Now we are going to inhibit this so that CAMP will remain as a CAMP. This cyclic adenosine monophosphate kasi is very beneficial in the body because it can cause vasodilation. So if it can cause vasodilation, it will improve blood flow even in the periphery to help a person with intermittent claudication since there is an obstruction and if you're going to dilate, makakadaan yung blood and can supply oxygen in those area. Okay, or even all over the body. Your internet connection is unstable. Anyway, I hope wala to nagputol. But aside from that class, silostazol is also an antiplatelet. Okay? Para siyang, tawag dyan, aspirin. Okay? Meron siyang ganun na action to prevent the platelet from like coagulating and forming a clot. So remember, di ba, when this atherosclerotic plaque or atheroma gets injured or merong rupture, it will result to clotting. So, wait lang. Wait lang. Excuse me for a while. Okay, sorry for the interruption. Again, ginagamit itong antiplatelet class para hindi mag-coagulate. Kasi pag mag-clot na, ano, ma-obstruct pa more yung daanan ng ating blood. So wala na talagang blood supply in that area. Remember na mamatay yung ating tissues class pag walang oxygen. Okay? So ito yun, the silostazole. We can also use this for intermittent claudication. Okay? This is the end of the slide. Do you have questions?